So I promised myself I would do this video, even though I'm really tired. Observations of the day is a couple new clients came in, and the biggest thing is core. So as a massage therapist, we were taught to do the digestion massage of the stomach, but we were never really taught to work the individual muscle fibers of the rectus abdominis, transverse obliques, stuff like that, or even the pecs around the breast tissue through the sternal line. Like, I don't remember ever doing that, and I've been to a lot of people who don't work that at all. I'm the opposite. So I get a lot of very complex cases where people have seen everybody underneath the sun, PTs, OTs, um, massage therapists, specialists, and they're still struggling to get what they want out of their body. So, a couple of them today, without getting too detailed, is basically everything revolved around the core. This right here, this part. I feel like I'm just saying the same thing over and over again in all my videos. It's all about the core. Kid came in with right shoulder pain, couldn't throw a baseball. Massage therapist looked at the shoulder, addressed it. PT, I don't think they started PT, but they did imaging and nothing's torn. And I didn't touch the shoulder really, but it got better. Why? Because this was completely unmanaged. Underwear was too tight. Was wearing underwear at night. He's very hypermobile, and hypermobile people have it very little low tolerance to any kind of bands on their system, and it really throws off their body. So if you're hypermobile and you have a band that's, you think it's not tight, but it's tight enough to make a snap, or the clothes are not falling off your body when you're standing up, they're probably too tight, especially for hypermobile. Worked his whole system. We were able to actually, when we were prone, he had shorts and underwear on or whatever, and we tucked the sheet underneath the waistband and then loosened his glutes. And I said, you know, how does that feel? And he's like, his legs feel lighter. So then I removed the sheet from the waistband, and I said, move your feet around, legs around. It's like, what do you feel? He's like, instantly when you remove the sheet, I could feel the heaviness in my legs. One great thing is when I work on minors, always have their parents in the room, and the look on both of their faces when we were testing the system and retesting, um, it's quite magical. I think it's just, it makes them so open to what the possibilities are and how the body works. Because we got a lot of good relief with his session today. I had another client who has been through so much scrutiny with other providers, and they just keep kind of hitting a brick wall. And her thing is her bra. She doesn't wear panties or underwear. She does wear high-waisted pants, but those weren't an issue. It was her bra. It was a sports bra. She's hypermobile. We even tested it after after the session, and she felt lighter after we did like 55 minutes supine and like 5 minutes prone. I don't typically do just 5 minutes prone, but since the way her body was acting, it felt like it was needed to be done. So we just did like this half drape flush. We just basically push the fluid from we push the body. I don't know if you want to call it fluid or not, but we push the body from the ankle all the way up to the shoulder, and we were able to release the glute system through the process of that, and the leg and the calf just completely softened. So then she came out. She felt lighter. She's asking about underwear, bras, sports bras, stuff like that, clothing, things you can do. Very proactive with her approach. And the biggest thing is don't wear a bra. I know it's easier said than done. If you're small chested, you can get away with it versus the heavier chested ladies that I work on. But any band, any restriction around the body, whether it's on the rib cage or the hip, same thing. It's going to cause an issue. Let's see what else. That's all I got today. I'm just kind of, I feel like a little bit lagged from coming back from vacation and then getting slammed with clients, which I want, but I'm definitely not sleeping as well as I need to be. I probably need a massage. That's probably what that means. I need my style of massage. So I still have some openings. Um, I still have classes that I'm producing to teach what I know, the mindset that I know. If you're a massage therapist or even a PT, or you want to know kind of how my brain works, send me a message. Ask if you got a problem case and you're not quite sure what's going on. Send me a message. I'd be happy just to even listen to it and see if there's some kind of information. I've got so many patterns that I've seen over the years that I can basically talk to people and have a pretty good idea what's going on. So, have a good day.